All right, we're going to get started. There are several things we want to cover. The main announcement is going to be with respect to our testing and contact tracing program. I do want to just say, just from our rental assistance program, because we opened up the portal today for landlords, apartment owners, people who rent to renters. They could register today starting at 10 o'clock. There has been a huge response from landlords and apartment owners throughout the city of Houston. About 2,700 have already registered in that portal as of this time. So that's a huge response. And then, of course, on May the 13th, the tenants themselves can start applying for the rental assistance. So I'm pleased with the movement and that's taking place on that program. In a few minutes, COVID-19 recovery czar Marvin Odum will announce the city's expanded program to contain the spread of the virus, including new details regarding testing, access, and equity, and how the Houston Health Department will increase its contact tracing workforce to monitor and contain the disease as more of the economy begins to open. But let me start today by saying that the city of Houston is reporting 88 new cases of COVID-19. That brings the total case count in Houston to 4,227. The total number of deaths in the city of Houston has increased to 85. That's 3 more than existed yesterday at this time. The 3 new deaths includes an Hispanic male in his 70s with underlying health conditions who passed away, unfortunately, on March 25th. And then there's a Hispanic male in his 60s with underlying health conditions who passed away on May the 4th. And then finally, a black male in his 50s with underlying health conditions who passed away on May the 6th. And so we're certainly praying for those families. The goal, and I look forward to the time when I can stand before you and say that there are no new reported cases, Dr. Purse, and no new deaths. So this is just a reminder with these numbers that this virus is still present in our community, still prevalent, and we need to continue to engage in social distancing, wearing our face covering. That's critically important. The numbers serve as a grim reminder and reality that COVID-19 is still in our community, and we must continue to promote all of the things that have helped to keep our numbers relatively low. I want to point out that as Mother Day approaches on Sunday, wearing facial coverings is important to protect our moms, grandmothers, and the women in our lives, as well as others. So please, please, let me stress the importance of face coverings, especially for individuals who are in at-risk and vulnerable population. But quite frankly, it applies to each and every one. Now, I'm also pleased to introduce, I guess one would say a celebrity mom, but she's a celebrity in her own right, and that is Tina Knowles Lawson, who we all know. Tina Knowles Lawson is the mother of one of the world's biggest stars, but she is also a star in her own right as a fashion designer, entrepreneur, and philanthropist. In fact, she's done so much in this city for so long. She joins us today to talk about how she is teaming up with BeyGOOD, the philanthropic initiative founded by her daughter, Beyonce, to provide testing in the city of Houston. And I can't express my gratitude enough to both Tina Knowles Lawson and Beyonce for what they have done, not just now, but over an extended period of time on behalf of the people in the city of Houston where they are from. Let's give a virtual City Hall welcome to Ms. Tina Knowles Lawson.
Thank you, Mayor.
Ms. Tina.
Okay. Hi.
Hello, hello.
Thank you for that warm welcome.
Thank you. Thank you for joining us, and thank you for the contribution that you and Beyonce are making to our city.
Yeah, well, it's our city too.
Yes.
We don't live there anymore, but you know, we have so much love for Houston. And we're just happy to be able to do some little small part. I mean, you guys starting the testing is amazing. Still in some cities, I understand that testing is not readily available. So when I heard that you guys had you were setting up these testing sites and that they were free, I got so excited about it. But then I heard from Congresswoman Sheila Jackson-Lee that that you weren't having like long lines, that at first there were a lot of people turning out, and then after some time it dwindled. And I just believe that that is the key to us finding out, if we have this virus, that we don't spread it to our communities and to our loved ones, because that is happening. And so if we can play some part in keeping those numbers down, that would make me really, really happy.
Well, let me just say to you, Tina, that you all have played a huge part, and we are doing everything we can to keep our numbers down. Collectively, people have done very well, but I would tell you we are very, very sensitive to people who represent our at-risk, vulnerable populations, our seniors, and then other people with underlying medical conditions, diabetes, on dialysis, hypertension, all of those things that specifically impact people across the board, but people that are living in what I call communities that have been underserved and under-resourced. And with the support that you all have been given, the supplies, it's making a huge, huge difference. And I want you to know on behalf of the City of Houston, we appreciate you and appreciate your daughter, Beyonce.
Well, thank you. And there are other people that have been so generous. Procter & Gamble has come in a big way. Matthew 25, on Friday, we teamed up with HEB. We bought gift certificates and they bought gift certificates for groceries. And, so everyone it's been a team effort. And Kim Gagne has been wonderful with, actually being doing me on the ground there, because obviously I can't be there because I have underlying conditions as well. But I'm just so proud of Houston for being at the forefront and for keeping, the numbers down. But I just encourage everyone to go get tested. It's really, really important. Well,
thank you. Look, we are proud of you, and we are proud of Beyonce and your family. And look, you may not be physically in this city, but this will always be your city, and we will always claim all of you as belonging right here in the City of Houston. So thank you so very, very much.
Thank you so much, and God bless you.
Happy Mother's Day.
Thank you. Thank you. Thank you, every mother there.
Thank you. Okay.
All right. Bye-bye.
Bye-bye. Tina Knowles Lawson. Okay. Look, and since Ms. Tina Knowles Lawson was talking about testing, as a fitting segue, when I appointed Marvin Odum, I asked him to work with strategies and to work with Dr. Purse and Director Stephen Williams and others, all of our departments and stakeholders, even outside and specifically with the county, to address the challenges faced by the city's vulnerable and at-risk populations, and to develop a plan to avoid resurgence of community spread amongst many other issues. On behalf of the COVID-19 recovery team, Marvin is here to discuss two major initiatives, testing and contact tracing, which are critical to protecting Houstonians as we move through the reopening phase. So let me yield at this moment and bring up Marvin Odum. Marvin.
Thank you, Mayor. Good afternoon, everyone. You didn't warn me I was going to have kind of a tough act to follow, but see what we can do here. So let me start by saying that COVID-19 remains a real and present danger in all our lives. As we continue to reopen Houston, we must do it safely and with a plan to protect the health of Houstonians. We must become even more strategic in our efforts to control the spread of the virus. Now, today marks a step change expansion in the use of our two most powerful tools, testing and contact tracing. Now, to that end, the Houston Health Department will develop a community-based approach to dramatically increase the accessibility to testing across our city. The locations for this expanded capability will be added rapidly, with over 24 new sites by the end of May, realized under the principles of access and equity. Now you can see on this map, let me just point out a couple of things. The existing sites are in red. The areas for the new sites, the first wave of new sites, are listed in green. Some of those areas will have more than one site. I didn't want to take you through a list of 24 sites here, but let me just mention a couple of them to give you a sense of the spread. During the week of May 11th to 16th, then you'll see an opening at the Melrose Community Center and the Clinton Community Center. May 18th through the 23rd, Lakewood Community Center and Hartman Community Center. And May 26th through the 30th, Hobart Taylor Community Center. So there's just a taste of the many locations to come. But again, let me emphasize again, our goal here is to have 24 sites open by the end of this month. Now we recognize that there are a diverse set of needs and mobility considerations in our communities. So we will be utilizing a combination of fixed sites, mobile testing units, and strategic outreach teams to ensure that we have adequate access for our population. The new sites will be implemented in priority groups designed to address our most vulnerable and at-risk neighborhoods first. In making these choices, we are guided by data from the CDC, from UT Health, and from the vast information that's available through our own city health department. What you'll see on the map that you can see now literally is where access intersects with equity. These are neighborhoods where people are more likely to die if they get COVID-19, and in many cases until now have had relatively limited access to testing, and we are changing that. While testing for the most vulnerable is of course crucial and it's our top priority, we also recognize that testing is important to everyone, and you can anticipate additional sites to come after those represented by the map that you're looking at here. Now, to implement this strategy, we are working with the Texas Division of Emergency Management, the United Memorial Medical Center, Kroger, and other organizations, and we want to give our deep thanks to all of them for their help. Also critical to success is an adequate supply of both personal protective equipment and all the supplies associated with testing. This supply chain situation that you probably heard a lot about, read a lot about, has improved considerably over the last month, so we currently believe that those supplies will be adequate to support the program that I've just laid out. But that's an area that we'll continue to watch very closely. A final point on testing. We will make these tests unrestricted, meaning they're available to anyone, and we'll make them free. Now, as we reopen the economy, we must also meet the growing demand to contain new infections as they are identified through this expanded testing. Now, this is the work of contact tracers, often called public health disease detectives. Now, the goal of contact tracing is to quickly notify people who have had contact with someone who has been infected and to notify them of what they need to do to protect themselves, their family, and their community. Now, this process involves interviewing patients to determine where they've been and with whom they've been in close contact so those people can get tested and the spread can be contained. And you see a simple graphic just representing that on the screen. Now, the city has already been expanding this capacity. It's been something that has been a high priority already. Currently, our health department has about 125 people supporting this role, with about 70 of those people that have been temporarily deployed from other jobs in the department. But even that is not enough as Houston reopens and the risk of transmission increases. So today's step-up plan includes an additional 300 contact tracers to manage an anticipated volume of COVID-19 cases. To find these people, we're going to tap into the talent of our local educational institutions and likely will be conducting job fairs as well. Now, not only will this allow us to meet the anticipated demands related to COVID-19, but it also gives us an opportunity to train part of our future public health workforce, so a dual benefit on that front. For both testing and contact tracing, I want to give special recognition to Director Stephen Williams, Rashay Jones, and really the entirety of the Houston Health Department team for bringing this to a reality. Now, there are many more aspects of the COVID response that we'll discuss in the coming weeks, but I'm going to end today with a final picture and a final comment. It's the tools that I focused on today, testing and contact tracing, combined with individual behaviors that will enable us to safely and successfully reopen Houston. Social distancing, masking up, sanitizing, all of these are essential to stopping the virus, and we need everyone to continue to do what we know has worked this far. Thanks very much. Mayor, back to you.
Let me thank Marvin for that report dealing with testing and contact tracing. And again, as he indicated, I do want to acknowledge Director Steve Williams and Rashay. In fact, why don't y'all come up here somewhere? Certainly want to acknowledge the Houston Health Department under the leadership of Director Williams and Rashay for the huge number of hours that they have put into the program. Because without, it's not just testing alone, as Marvin indicated, it's testing, it's the contact tracing, it's our role, our responsibility. Everything is interconnected. And so this is an immense operation. And quite frankly, I would tell you, it will consume a huge percentage of the dollars, of the COVID dollars that we have received from the federal government, of that $404 million. So I do want to acknowledge Director Williams, Rashay, the whole Houston Health Department, and that team for the work that they have done in this regard. Marvin, I know this is very important if we are going to manage this virus as we go forward. So at this point, let me call on Dr. Peirce for his report, and then we'll go from there. Dr. Peirce.
Thank you, Mayor. And I'd like to echo basically everything that Marvin said, and what the Mayor said, that this effort is huge and is require a large army of people. We've talked about the public health army that we need to build, and Mr. Odum pointed out how we're going to be building that army, and Director Williams has already moved people into this from other areas of the department, and so those functions will continue to function as well, but you can see how there's a lot of work to be done. One of the other things I want to underscore that Mr. Odum pointed out was the third circle. There's, testing, contact tracing, and then individual behavior. And so one of the things that folks need to keep in mind is that as we move forward and as we gain more information from the testing, followed by the contact tracing, and we are to better inform individuals within the community that they either are a case, that they are infected, or that they have been exposed to someone and therefore a contact of a case, that they will need to then follow the advice of the public health folks who call them and contact them with that information and follow their advice so they don't spread the virus. That's what works. So it's your graphic of the 3 overlapping circles, 2 out of 3 won't work. We need to have all 3 in order for it to work. And at the end of the day, it's the individual's responsibility, because no matter how big we make the army, we're not going to be able to sit in front of your house and make sure that you follow the rules. You're going to have to take on that individual responsibility. But by doing so, you're protecting the people closest to you. That's your family members, those people you love the most, your neighbors, and your coworkers. So it should really not require a lot more than information to educate folks to get us to go there. And part of that public health arm, I wanted to point out that this is National Nurses Week. In fact, yesterday was National Nurses Day, and I forgot to mention that. But a lot of the folks in our public health army are nurses, and we've clearly seen across the nation the impact of this COVID pandemic on many areas of the healthcare industry, and in particular nurses. So although it's a day late, a thank you and recognition to the nurses of every discipline and every level of nursing for all the hard work that you've done and that you're about to continue doing. Thank you, Mayor.
And before we go any further, because this is so important, the testing, the contact tracing, the individual responsibility, and then we're going to be adding another 300 contract tracers to the 125 that we have. So we're talking about 425. But in order for them to be able to do their job, we have to keep the numbers relatively low. Because if you have more people getting infected, that means you're going to have to build even a bigger army.
As Marvin referred to earlier, we've already redeployed 70 people that were employees of the Houston Health Department to the number of 45 that we already had. Recruiting is underway now. We're looking for academic institutions and other community partners to help us fill the role of that up to 300 people. The number that we're starting with right now is about 24, but if you look very closely at the slides, we said that some of them are currently in operation. What we found out is that as we began testing, sometimes the number of people that report to a specific site might decrease, and so therefore we're adding some flexibility in our approach. You also see the utilization of mobile units. We know that there are specific communities that need real targeted outreach, and so we're using the mobile units that are staffed by the Houston Health Department, but we also are reaching out to community partners that have particular relationships in certain communities. We were able to access information from CDC that told us how many people had been tested in a particular zip code. And so the first measure that we looked at was whether or not we believe that enough people had been tested in those particular zip codes. Those blinks represent the fact that those zip codes have met a certain threshold of people that have been tested. What you see there is a combination of those zip codes where enough people, we believe enough people had not been tested, and what we call equity, and that was those populations that are vulnerable zip codes. And we were able to access information from UT School of Public Health, Dr. Linder's report, to inform that decision.
Stephen, can I just add something? Sure. I just wanted to add, and Stephen mentioned it earlier, don't look at this map and say it's a one and done deal, right? So this is an evolving situation. There will be more sites required over time. We may move some sites over time. This represents, and the highlights represent, those priority areas that I mentioned for all the screening elements that Steve had mentioned. This is addressing our vulnerable populations. This is a very strong start in addressing where the gaps have been.
Just this weekend, working with UMMC, testing took place in Southwest Houston. Specifically, do you know what that location?
Yeah, that occurred at Pilgrim Academy in the Southwest area. And we wanted to mention also, so with strike teams, which is occurring all over the city, when we see, I don't know the term to you, increase, or it becomes more of a hot spot is what we define, we send a mobile unit out there, no matter if it's not in these zip codes. So I hope that makes sense. So we do have a traveling team that's going all over the city.
Thank you, Mayor. Thank you, Mayor. Good afternoon, everyone. My report today is going to be the same as yesterday. We've remained essentially with no change, which is a positive for us. We haven't had any more positive tested firefighters for coronavirus, and we haven't increased the number of personnel in quarantine. So we're attributing that to the fact that we're doing the right thing out there on each one of our emergency response, wearing the proper personal protective equipment, ensuring that we're approaching the scenes with caution, and ensuring proper hygiene and distancing at our fire stations. It's the exact same model that the mayor has been alluding to, and Mr. Odum has been alluding to, that we need to do as a community. Essentially, wash your hands, proper hygiene. If you're in public, and especially with personnel in a room, wear your masks. It's to prevent you from spreading anything to other people. That's going to keep the numbers down. That's going to keep this situation manageable. Thank you.
And Chief Buning from the Office of Emergency Management.
Great. Thank you, Mayor, for your leadership and for continuing to expand the city's capability for testing access to those locations that need it the most in the city. Project CURE is still taking donations on behalf of the city for our first responders, and they're going to be delivering another allocation to the city to keep our employees safe. So I want to thank Project CURE. And then also, we're still in Hurricane Preparation Week, and the tip of the day is securing your home. And this includes securing your windows, trimming your trees, and also securing your outdoor furniture in the event that the storm is coming up. It's never too early to prepare. Hurricane season starts June 1st. Thank you, Mayor.
I hope people will exercise their common sense and will take the necessary steps. You just heard from Marvin Odum and the Health Department talking about the need for testing, contact tracing, and individual responsibility. Those three things are needed in order to protect people in this city so that 3 to 4 weeks or a month from now, we don't face what we faced in March and in April, and we are not forced to kind of repeat these work safe orders again. That's the hope.